Hello and welcome to Lecture 1 on Psychological Disorders. So now we're going to start looking at mental illnesses. And students usually really like this chapter. So in this lecture, we're going to understand what a psychological disorder is. What does that term mean? We're going to look at how psychological disorders are classified, and we'll identify assessment methods for psychological disorders. And these are learning objectives for the next couple lectures. So, if something is called a psychopathology, it just means that it's a disorder of the mind. So, psychopathology is just a disorder of the mind. Now, sometimes you'll be reading, and you'll come across the word etiology. When reading about etiologies in psychology, medicine, things of that nature, the etiology is the factors that contribute to the development of a disorder. So an example would be depression. Depression has many factors that can contribute to it developing. So an example could be childbirth. It's very typical, very common for women to have decreased mood after childbirth. That could be the etiological cause for one patient's or one client's depressive episode. Another could be complex grief. So when we're looking at an individual client, we're looking at their specific etiology. Now, earliest views of psychopathology explained the apparent madness as resulting from possession by demons or evil spirits. They found skulls that are thousands of years old that have holes drilled in them. And these are in many different cultures. The theory was that by drilling into the skull, the person with the mental illness, the evil spirits could come out of their head, literally out of their head. And if you look at the history of mental illness, the concept of evil spirits, of demons, the etiology was for many thousands of years believed to be religious in nature. We know that when it comes to mental illnesses, environmental factors are very important. Now we also have a much better understanding of the role of biology. So, I think it was like 1996 when the human genome was mapped. That was a huge leap in the treatment of all medical issues, and psychological disorders are medical issues. So we have a better understanding now of this nature-nurture issue. What are environmental triggers for different disorders, and what might be biological disorders or triggers for disorders? Something that's been really fascinating that's been discovered is that the disorders bipolar disorder and schizophrenia are highly heritable. The genetic predispositions for these two illnesses are huge. What does that mean? That means that if someone in the family has bipolar disorder, someone else does too. The person may not be diagnosed, or like it runs in my family. My dad had it, but he wasn't formally diagnosed. But other family members do too. But we're missing some of his family history because he was adopted by his stepdad. His birth father disappeared when he was teeny tiny. So we're missing a big chunk of his family history. And because bipolar disorder is so heritable, we really wish we had that chunk, that piece of the puzzle. So it's becoming very helpful to understand that there are some disorders that are, their etiology is genetic. Now, does that mean that environmental factors don't play a big role when it comes to illnesses like bipolar disorder or schizophrenia? Absolutely not. We have to really it's the chicken and egg question. And when it comes to managing these illnesses, we have to figure out what are the environmental factors that trigger symptoms. The underlying cause is often genetics, but we have to figure out what is it that triggered that genetic predisposition. For a genetic predisposition to be triggered, you must encounter some kind of stressor. A genetic predisposition isn't going to trigger unless you experience certain stressors. And that can be something as simple as poor diet. So, one of the things we're curious about is what are the environmental factors that could trigger a genetic predisposition for bipolar disorder or schizophrenia. Psychological disorders are common, and they account for the greatest proportion of disability in developed countries. Mental disorders range in severity, and there are enormous sex differences in psychopathology, and we're going to look at that a lot throughout this chapter. So, only about 7% of the U.S. population is severely affected by mental illnesses. What's interesting is this group tends to suffer from multiple disorders simultaneously. And so it's that comorbidity, the combination of disorders that is so disabling. And when one disorder is present, if there's another one that's present, trying to manage both disorders becomes difficult. And then you have a symptom flare-up of one disorder, which then triggers the other disorder, and it's messy. One of the challenges with looking at psychological disorders is trying to define what's the normal human experience versus a mental disorder. So grief, I think, is a really great example. Where does grief become major depressive episodes? That's a really hard thing to determine because the symptoms are very much the same. They're not identical, but they're very, very similar, but the etiology is different. So, grief comes from loss. Depression, generalized depressive disorder doesn't typically start with loss. It can, but grief can transition into a major depressive episode. And so there is a difficulty trying to define the line between a normal emotional experience like grief and a mental disorder like generalized depressive episodes. I want to be very, very clear about this. You're all going to run and start reading about mental illnesses, and you're going to start seeing yourself in a lot of them. You do not have a lot of mental illnesses. I can't say that you don't have any mental illnesses, but even if symptoms seem to describe you perfectly or someone else you must resist that urge to make a diagnosis. Something they see in medical school is when students are learning about new diseases, all of a sudden they start to worry about that they have that disease. And, any little symptom or any physiological response that could possibly be linked to a symptom. Oh my God, I'm developing that disorder. It becomes very, very easy to overanalyze ourselves. And I urge you to be cautious with this. Diagnosis is more than just looking at symptoms. When we're diagnosing clients, we're not just looking at the DSM and its list of symptoms. It's critical to have a patient or client interview as well, because we have to make the symptoms make sense. Resist the urge, people. Resist the urge. Now, in determining whether a behavior represents psychopathology, it's important to consider a few things. Does the person act in a way that deviates from cultural norms for accepted behavior? Is the behavior maladaptive? Now, if something is adaptive, it helps us survive and reproduce. It enhances our ability to live a good life. If something is maladaptive, it interferes with our survival and reproduction, with our with living an optimal life. Is the behavior self-destructive? And does the behavior cause discomfort and concern to others, thus impairing a person's social relationships? So this is kind of an example of why you can't just go look up a list of symptoms for a disorder in the DSM-5. You need to be looking at, okay, well, if I see these symptoms, okay, well, but culturally, is this a deviation in whatever culture that client is in? Is this symptom maladaptive for this individual? It might not be. Is it self-destructive? Maybe it is, maybe it isn't for that specific client. What kind of discomfort is it causing? A big piece of the puzzle with psychological disorders is the issue of maladaptiveness. This is becoming a core concept with psychopathology. So, a person with psychopathology exhibits thoughts, feelings, and behaviors that are maladaptive. You know, it used to be that some of them were considered deviant, but now we perceive these as maladaptive symptoms and disorders. So thoughts, feelings, and behaviors that are maladaptive, that are harmful to daily life. Symptoms of the disorder must interfere with at least one aspect of a person's life, such as work, social relationships, self-care. Other examples would be grades, classwork, parenting, your relationship with a significant other, things of that nature. Now, in the 1800s, psychiatrist, I can never say his name properly, so just read it, identified mental disorders on the basis of groups of symptoms that occur together. Now, in 1952, the American Psychiatric Association ran with this idea and published the first edition of the Diagnostic and Statistical Manual of Mental Disorders. Now, in the current DSM-5, they now go with classifying disorders based on observable symptoms. So this is the DSM-5. So now I want you to go watch these two videos, and they're going to talk about, the origins of the DSM. And the second one, Diagnosis with the DSM, is going to look at the good and the bad of the DSM. The DSM is not a perfect concept. It's a very useful book, and it is the Bible of psychiatry and psychology, but it's not flawless. So I want you to go watch these videos, and then I'll meet you back for lecture 2. Thank you.